Welcome to mtwisdom. Have you ever felt unusually tired, dizzy, or just off but couldn't quite explain why? For older adults, the cause is often simpler than you think: dehydration. It might sound harmless, but in people over 65, even mild dehydration can lead to serious problems: falls, confusion, kidney issues, even hospitalization. Yet many seniors and their caregivers completely miss the warning signs. In today's video, we'll uncover 12 subtle, yet critical signs of dehydration in seniors that you can't afford to ignore. These aren't just symptoms, they're the body's quiet cry for help. So stay with me until the end, because recognizing just one of these signs could protect your health or even save a life. Sign 1. The thirst myth. You'd think thirst would be the first and clearest sign of dehydration, right? But here's the surprising truth. For seniors, the sensation of thirst may vanish entirely even when the body is dangerously dry. In fact, many older adults may go an entire day without feeling the urge to drink water. This is not laziness or forgetfulness, it's a natural consequence of aging. The part of the brain that controls thirst, the hypothalamus, simply doesn't function as sharply as it once did. This decline means that by the time a senior actually feels thirsty, they may already be significantly dehydrated. Some studies have shown that adults over 65 are among the most vulnerable to dehydration because of this blunted thirst response. Compounding the problem, many seniors are on medications like diuretics that increase water loss through urine, making it even more critical to drink regularly despite not feeling thirsty. You might be thinking, then how do I know when I need to drink? The key is not to wait for thirst, but to make hydration a routine, not a reaction. You can look for other subtle signs your body gives, like dry lips, crankiness, or a dip in energy. These are often the only clues you'll get. That's why creating visual cues is powerful. Placing a brightly colored water bottle on your table beside your favorite chair or by your medication tray can work wonders. You'd be surprised how often just seeing the bottle reminds you to drink. Even if you only take a few sips at a time, that consistency matters. Aim for a gentle stream of hydration, not big gulps all at once. Sign 2. Urine color tells a secret. Here's a powerful tip that could literally save a life: look at your urine. This may sound simple, even obvious, but urine color is one of the most reliable and visible early signs of dehydration. In a well-hydrated body, urine should be pale yellow, almost clear. Think of the color of lemonade. That light color means your body has enough water to flush out toxins and waste properly. But when you don't have enough fluid, your body tries to hold on to what it can. Your kidneys concentrate your urine, and it turns a darker yellow or even amber, like apple juice. That's your body's warning light flashing: I'm running low. Why is this especially important for seniors? As we age, our kidneys become less efficient at filtering waste. That means the body relies even more heavily on proper hydration to maintain balance. If dehydration sets in, the kidneys can't do their job, and the risk of urinary tract infections, kidney stones, and toxin buildup increases. Here's an easy way to monitor your hydration: use a clear plastic cup or a transparent container. Compare the color to a hydration chart if needed. Some charts are color-coded to help you understand the difference between healthy and warning shades. A small but powerful change is to make checking your urine color part of your daily routine, especially if you're on medications like diuretics or blood pressure drugs, which can increase fluid loss. And remember, don't try to catch up all at once. If your urine is dark, don't chug an entire bottle of water. That can overwhelm the system. Instead, take small sips of water consistently throughout the day. Let your urine guide you. It's one of the easiest, most natural health checks your body gives you for free. Sign 3. Sudden confusion or delirium. If your loved one starts acting oddly, forgetting names, getting agitated, or seeming lost in their own home, it may not be dementia. It could be dehydration. This is one of the most overlooked symptoms in older adults. Families often mistake it for cognitive decline, but the truth is more hopeful and more urgent. When the body is low on fluids, blood pressure drops, reducing the amount of oxygen-rich blood flowing to the brain. The brain, sensitive to even slight changes in oxygen or hydration, begins to misfire. The result: sudden confusion, mood swings, dizziness, or even mild hallucinations. Imagine grandma walks into the kitchen and pauses. She's forgotten why she's there. Then she calls you by your sister's name. You worry, could this be the start of dementia? But in reality, she may simply be dehydrated. And the solution is far more gentle than you think. Older adults are more prone to this symptom because, as we've said, they may not feel thirsty. Combine that with common medications like antihypertensives, diuretics, or laxatives, and fluid levels can drop quickly. Add heat or illness, and the risk rises even more. In these moments, the best approach is to respond with calm and care. Start by moving them to a cooler, quieter room away from bright lights and background noise. That gentle change in environment alone can reduce agitation. Instead of overwhelming them with a full glass of water, try offering small, regular sips or, if they prefer, bite-sized pieces of watermelon or cucumber. These hydrating foods are often more appealing, especially for someone who feels unwell. Sometimes confusion will fade as hydration returns. But if it doesn't improve within an hour or worsens, don't delay in contacting a healthcare provider. When it comes to cognitive changes in seniors, it's always better to be cautious. And perhaps the most important takeaway here is this: making hydration part of a senior's routine, especially for those with memory issues, can prevent this altogether. Even small, steady habits like sipping water every hour can help keep the mind clear and the body balanced. If you found this information helpful, please support us by clicking the like button. It really helps us reach more people who might need it. Sign 4. The skin pinch test. There's a simple, almost foolproof way to check for dehydration, and you don't need any fancy tools to do it. Just use your skin. Try this: gently pinch the skin on the back of your hand, then let go. If the skin quickly snaps back into place, that's a great sign. It means your body still has enough moisture in its tissues. But if the skin stays lifted for a second or two, looking tented or slow to flatten, it's a sign of poor skin turgor. And that, in older adults, is often a direct result of dehydration. Why does this happen? As we age, our skin naturally loses elasticity. But when the body is also lacking fluid, the tissues beneath the skin become depleted. This creates the telltale delay when the skin is pinched and released. It's not just a surface issue, it's your body's way of waving a small, quiet flag. This test is especially useful after bouts of illness during hot weather, or if you or your loved one has had diarrhea or a poor appetite. Even missing a few glasses of water over the course of a day can be enough to trigger noticeable signs. If you do notice a delay in skin rebound, don't panic but do respond. Start with small sips of water or clear broth. Herbal tea and fresh fruit with high water content, like melon or oranges, can help as well. These options are often gentler for someone who's not feeling well or who resists plain water. And if you're a caregiver, consider adding this test into your regular routine. It's quick, it's painless, and it gives you valuable insight, especially for seniors who can't always communicate their needs clearly. By making this a small habit, you can catch dehydration before it becomes a serious issue. And that's one of the simplest, most powerful forms of prevention. If this tip helps someone you care for, please consider giving this video a like. It tells the algorithm that this information matters. Sign 5. Dry, burning eyes or blurred vision. Have your eyes ever felt gritty, irritated, or unexpectedly blurry? For many seniors, these uncomfortable symptoms are often dismissed as needing new glasses or just getting older. But the real issue might be something much simpler and easier to address: dehydration. You see, your eyes rely on moisture to function properly. They're coated by a thin film of tears that keeps them lubricated, comfortable, and clear. But when your body doesn't have enough water, it prioritizes vital organs first, and your eyes aren't at the top of that list. As a result, tear production slows down. This leads to dryness, stinging sensations, redness, and even blurred vision. Many older adults experience this dryness without realizing it's connected to their hydration levels. And unfortunately, it's not just about discomfort. Dry eyes can also increase the risk of infections, since tears help wash away dust and harmful particles. Imagine trying to read your favorite book or enjoy an evening movie, but your eyes keep burning or watering from dryness. It's more than annoying, it limits your quality of life. The good news is that even mild improvements in hydration can bring noticeable relief. So what can you do? Begin with gentle changes. Sip water consistently throughout the day. Don't wait until your mouth is dry, your eyes may already be suffering by then. Adding water-rich snacks like cucumbers or strawberries can also help keep your body and your eyes hydrated. And if your eyes are feeling especially irritated, place a cool, damp cloth over them while you rest. Reducing salt in your meals can also help, since salty foods pull water out of your system. If dry, Burning eyes are something you deal with regularly. It could be your body's quiet way of saying, I need more water. Sign 6. Headaches that come out of nowhere. Ever experienced a headache that sneaks up on you while you're out gardening, walking, or even just sitting in the sun? It's easy to blame it on the heat or a poor night's sleep, but the real culprit might be something simpler and more fixable: dehydration. When your body lacks enough water, the volume of blood circulating through your system drops. This leads to lower pressure and slower delivery of oxygen to vital areas, including your brain. Without proper hydration, your brain quite literally shrinks slightly from fluid loss, pulling away from the skull and triggering pain receptors. The result? That familiar throbbing ache, sensitivity to light, or a dull pressure behind your eyes. And if dehydration continues, that headache can intensify, accompanied by nausea, dizziness, and difficulty concentrating. It's important to understand that popping a painkiller might numb the symptoms temporarily, but it doesn't solve the root problem. If the body is lacking fluid, what it truly needs is gentle, consistent rehydration. Instead of reaching for medication right away, try stepping into a cool, shaded room. Sit down, close your eyes, and begin sipping water slowly. Don't gulp it. Adding a slice of cucumber or lemon can make it more palatable, especially if you're not a fan of plain water. Also consider whether you've consumed caffeine or salty foods, both of which can worsen dehydration. Adjusting your intake in small ways can often prevent these headaches before they start. So the next time your head starts pounding out of nowhere, pause and ask yourself, have I had enough water today? Your answer might change how you respond and how fast you recover. If you found this information helpful, please click the like button to support the channel. And don't keep it to yourself. Copy the link and share it with someone you care about. You never know who might need it. Sign 7. A heart that starts racing. Have you ever noticed your heart suddenly pounding, even though you're just sitting down or not under any stress? That fluttering or racing heartbeat might feel like anxiety or exertion, but it could be something else: severe dehydration. When your body is low on fluids, your blood volume drops. With less liquid circulating, your blood becomes thicker. The heart then has to work harder to push this more concentrated blood through your vessels. This increased effort puts added strain on your cardiovascular system, especially dangerous in older adults, whose hearts may already be under stress due to age or medication. This isn't just a minor annoyance. A racing heart caused by dehydration can lead to feelings of lightheadedness, weakness, and in severe cases, fainting. The risk is even higher if you're taking diuretics, water pills, which remove fluid from the body, or if you're sensitive to heat, which speeds up fluid loss through sweat. What makes this even more concerning is how easy it is to overlook. Many seniors assume it's just the summer weather, or that their medication is causing some discomfort. But ignoring these signs can be risky. If your heart is beating faster than usual, especially while at rest, pause and check your other symptoms. Are you dizzy? Have you urinated recently? Do you feel unusually dry or tired? If the answer is yes to any of these, dehydration could be the underlying cause. It's a good idea to keep a hydration log, especially if you've experienced heart palpitations before. Track how much water you're drinking and how you feel throughout the day. And if your heart is racing alongside fainting or no urination, go to the emergency room immediately. This is not something to wait on. Sign 8. Fainting or falling easily. Have you ever stood up too quickly and felt dizzy, like the room shifted under your feet? For many seniors, this sensation can lead to something far more serious: a sudden fall. One of the most common causes: dehydration. When the body is dehydrated, blood volume decreases, and that means blood pressure can drop significantly, especially when you change positions from lying down to sitting up, or sitting to standing. This is called orthostatic hypotension, and it's one of the most overlooked yet dangerous effects of fluid loss in older adults. What makes this particularly alarming is how subtle it can be. You might feel fine sitting down, but the moment you rise, there's a wave of dizziness, unsteadiness, or even blacking out for a few seconds. In those brief moments, many seniors fall on hard floors, into furniture, or downstairs, leading to fractures, head trauma, or hospital stays that can take months to recover from. If someone you love is fainting, especially in the morning after getting out of bed, one of the first questions to ask is, how much fluid have they had in the past 24 hours? You may find that they've barely drunk anything. In these moments, the response needs to be calm but immediate. Help them lie down safely, raise their legs slightly to restore blood flow to the brain, and offer small, steady sips of water. Never rush fluid intake, and once they're stable, call a doctor to assess whether additional intervention is needed. As a general guideline, older adults should aim for at least 9 cups of fluid daily for women and 12 for men. More may be necessary during warm weather or when taking medications that increase fluid loss, like diuretics or laxatives. Sign 9. That sticky, dry mouth. It's one of the easiest signs to spot, yet often the one we brush off the fastest. That uncomfortable feeling in the mouth, dry, sticky, maybe even slightly sore. If someone is frequently licking their lips, speaking with a raspy or sticky sounding voice, or complaining about a dry throat without having a cold, don't ignore it. These are some of the earliest warning signs of mild dehydration. Saliva plays a bigger role than most people realize. It keeps your mouth moist, helps with swallowing, and even begins the process of digestion. But when your body doesn't have enough fluid, it conserves water, meaning saliva production slows down. The result? A mouth that feels sticky, dry, or coated. Over time, this can lead to difficulty chewing, changes in taste, or even mouth sores. For seniors, dry mouth isn't just a discomfort. It can interfere with appetite, speech, and dental health. It may even increase the risk of gum infections or cavities, especially if medications are also contributing to the dryness. The best way to respond is not to gulp down a large glass of water at once, but rather to encourage small, steady sips throughout the day. Water-rich fruits like oranges, grapes, or watermelon are great choices too. They hydrate and soothe at the same time. It's also important to avoid caffeine or alcohol, as both act as diuretics, pulling water out of the body and making the problem worse. So the next time someone says, "My mouth feels dry," don't dismiss it. It may be their body's first way of saying, "I need more water." If this insight helped you or could help someone else, please like the video and share the link. You never know who might need to hear it. Sign 10. Heat makes it dangerous fast. Hot weather can feel wonderful, but for older adults, it brings an invisible danger that can escalate quickly. Dehydration becomes far more likely in high temperatures. And what's more, the aging body often doesn't respond to heat the same way it used to. As we age, our bodies lose some of their ability to regulate temperature. Seniors don't sweat as efficiently, and the thirst reflex becomes less reliable. That means heat builds up faster and fluids are lost more rapidly, often without the person realizing it until symptoms begin to show. The signs might be subtle at first: flushed skin, lightheadedness, or faster than usual breathing. But left unaddressed, heat-related dehydration can quickly lead to heat exhaustion or even heat stroke. One of the biggest risks is that older adults often underestimate how much heat is affecting them. They may sit outside just for a few minutes, but if they're not hydrating before, during, and after that exposure, those minutes can take a toll. If you notice a senior looking red-faced, sweating excessively, or not sweating at all, or feeling nauseous, don't wait. Move them to a cooler indoor space immediately. Applying a damp cloth to the forehead, neck, or wrists can help reduce body temperature. And offering small sips of cool water helps replenish lost fluids without overwhelming the stomach. You can also prepare ahead. Keep frozen fruit slices like grapes, berries, or watermelon chunks ready in the freezer. These are not only refreshing but also add hydration and comfort during a hot day. The key is prevention. Don't wait for thirst or overheating to show up. On warmer days, increase fluid intake early and plan for breaks in the shade. If this information was helpful, consider hitting the like button to support us in building a valuable and informed community. And don't forget to share the link. You never know who might need it today. Sign 11. Urinating less often. How often do you or someone you're caring for actually go to the bathroom each day? It may not be a comfortable question, but it's one that could reveal a critical health warning. If someone hasn't urinated in 6 to 8 hours, or if they're going significantly less than usual, it could be a red flag that their body is low on fluids. Why? Because when dehydration sets in, the kidneys respond by holding onto as much water as possible. Less urine output means there's simply not enough fluid in the system to spare. This reaction is the body's attempt to protect itself, but it comes at a cost. Waste products remain more concentrated, which can strain the kidneys and increase the risk of urinary tract infections, kidney stones, or other complications. For seniors who may already have reduced kidney function, this can become serious fast. Another challenge is that older adults might not always feel the urge to go, or may avoid fluids to reduce bathroom trips, especially at night. But that habit can actually backfire, leading to dizziness, fatigue, and further dehydration. One way to help is by making hydration part of a routine. Instead of waiting for thirst, try drinking water at the same time as other daily habits, after brushing teeth, during meals, or when taking medications. Associating drinking with something familiar makes it easier to remember. Technology can help. 2. Setting gentle phone reminders labeled something like "time to sip, not skip" can be an effective and non-intrusive nudge. And don't forget, urine color and frequency go hand in hand. Keep an eye on both. They're among the simplest, most honest health signals your body gives. Sign 12. It's a medical emergency in disguise. Of all the signs we've covered, this may be the most critical because at this stage, dehydration is no longer just a concern. It's a full-blown medical emergency. When dehydration becomes severe, the symptoms are not subtle. You might notice confusion, where someone suddenly seems disoriented, unable to answer simple questions, or recognize familiar people. They may stop urinating altogether for 12 hours or more. Their heart may race, even while resting, and they might feel faint or collapse. Worse still, they might not be able to keep fluids down, a serious issue because oral rehydration becomes impossible. At this point, the body is dangerously low on fluid and electrolytes, and IV fluids are the only safe way to restore balance. This isn't a moment to wait and see. If these symptoms appear, it's not about trying a few sips of water or taking a nap. It's time to call 911 or go to the nearest emergency room. Every minute counts. And just as important as acting in the moment is knowing how to recognize the danger before it reaches this point. Many caregivers, especially family members, assume dehydration is only about thirst. But in seniors, it's often silent, developing slowly and showing up only when the situation is already urgent. That's why education and awareness matter so much. If you're caring for an older adult, make sure everyone around them, family, friends, neighbors, knows the warning signs. Share this information. Keep a printed copy of symptoms on the fridge. Make it part of your home care plan. Severe dehydration is preventable, but only if we know what to look for. Please like this video and share it with someone else who needs to be informed. Your action could protect someone's life. Let's take a moment to reflect. Did any of these signs sound familiar to you? Maybe it was the confusion, the dry mouth, the lack of thirst, or the racing heart. Here's the good news: most dehydration is preventable. With awareness, with small daily habits, and with gentle reminders, we can protect ourselves and those we love. And if this video could help someone else, don't keep it to yourself. Click share or copy the link and send it to a caregiver or family member. Like this video to let YouTube know it matters. And if you haven't already, subscribe to mtwisdom and turn on the bell. Because here we believe quality of life matters more than anything else. Until next time.